Welcome to this presentation on preventive radiology, individualized prevention and early intervention, conceptualized and founded by Dr. Rijo Mathew Choorakuttil. This presentation is based on the white paper developed by Dr. Rijo Mathew Choorakuttil and Praveen Nirmalan et al. For the Indian Radiological and Imaging Association's Preventive Radiology Committee. Preventive radiology represents a vision where imaging is not limited to diagnosis, but becomes a key element of prevention, identifying disease early and guiding personalized interventions. With rapid advancements in imaging technology, healthcare professionals can now detect diseases at their earliest stages, often with minimal contact and no pain for patients. This approach not only improves outcomes, but also reduces the overall cost and burden of treatment. In this video, we'll walk through the principles, applications, and future directions of individualized prevention and early intervention, as outlined by the Preventive Radiology Program of India. Early detection is the cornerstone of preventive medicine. Through advanced imaging techniques, clinicians can objectively assess the onset and progression of diseases, often before any symptoms arise. This allows for timely interventions that can mitigate both short and long-term effects of illness. Screening programs, powered by imaging, are tailored to the prevalence and risk factors of diseases at national and regional levels. By identifying conditions like tuberculosis, cancers, and heart disease early, we can significantly improve patient outcomes and reduce healthcare costs. Screening is not just about individual health, it's a population-wide strategy. Imaging-based screening programs are designed by considering the magnitude and distribution of diseases, associated risk factors, and the effectiveness of available interventions. These programs help identify at-risk groups and guide public health policies. For example, routine imaging for breast, lung, and colon cancers has become a vital part of national health strategies, enabling early intervention and better management of these conditions. By detecting disease in asymptomatic stages, imaging helps reduce long-term complications and overall treatment costs. Individualized medicine takes prevention to a new level by integrating population-based screening with personalized care. Clinicians consider each person's genetics, environment, and lifestyle to tailor prevention and treatment strategies. Medical imaging plays a crucial role in this process, enabling the detection of subtle biological changes before symptoms appear. This approach ensures that interventions are not only timely, but also specifically suited to each individual's unique risk profile. This is the essence of preventive radiology: early detection, personalized prediction, and precision prevention. The sequencing of the human genome has opened new doors in preventive medicine. Genetic variants can indicate a person's risk for certain diseases, influence disease progression, and even predict responses to treatment. Alongside genomics, biomarkers, measurable indicators of biological processes, are increasingly used to stratify patients into risk groups. Imaging biomarkers, in particular, allow for non-invasive assessment of disease at the cellular and molecular level, helping clinicians make more informed decisions. Imaging no longer only shows anatomy. It now visualizes physiology, metabolism, perfusion, and diffusion, providing a dynamic view of how disease evolves. This allows clinicians to act earlier and more precisely than ever before. Medical imaging supports three key models in individualized medicine: disease prevention, individualized diagnostics, and individualized therapeutics. The prevention model focuses on identifying preclinical disease and at-risk subgroups. The diagnostic model pinpoints the molecular and structural basis of disease, while the therapeutic model identifies which patients are most likely to benefit from specific treatments. Together, these models enable a comprehensive, patient-centered approach to healthcare. Personalized medicine uses genetic and clinical data to tailor decisions. Radiogenomics connects imaging features with molecular information. The Ranostics combines diagnostic imaging with targeted therapy, and stratified medicine identifies patient groups most likely to benefit from specific treatments. Population imaging is transforming prevention. Large imaging databases help identify biomarkers that predict disease before symptoms arise. Imaging biomarkers are now key to precision medicine. Prognostic biomarkers predict disease progression, while predictive biomarkers indicate how well a patient might respond to treatment. Together, these tools enable individualized, evidence-based care. Molecular imaging provides insights into cellular processes such as metabolism, angiogenesis, and gene expression. Radiogenomics links imaging patterns with genetic profiles, helping identify tumor behavior and treatment response. A powerful step toward precision oncology. Radiologists are at the center of this change. They must promote non-invasive preventive imaging, validate imaging biomarkers, and integrate radiodiagnosis with the Ranostics techniques. Through collaboration and innovation, radiologists will drive the shift from reactive diagnosis to proactive prevention. Preventive radiology marks a transformative shift in healthcare, from treating disease to predicting and preventing it. By integrating imaging, biomarkers, and individualized care, radiologists can truly image the future of health. The individualized therapeutic model, imaging helps identify which patient subgroups are most likely to respond to specific treatments. By integrating information about side effects, therapeutic options, and localized therapies, clinicians can tailor interventions to maximize benefit and minimize harm. This model is especially valuable in complex diseases like cancer, where treatment responses can vary widely. Medical imaging is no longer just about finding abnormalities. Today, it helps localize disease, assess its extent, and evaluate its impact on both structure and function. Imaging can also guide surgical planning, monitor organ function, and predict the success of interventions. By integrating data on physiology, metabolism, and molecular biology, imaging provides a comprehensive view of health and disease. Quantitative imaging and volumetric assessments are transforming therapeutic planning. By measuring disease progression and treatment response in precise, objective terms, clinicians can make more informed decisions. These techniques allow for early diagnosis, identification of predictive biomarkers, and monitoring of localized pathophysiology. The result is a more targeted and effective approach to patient care. Molecular imaging goes beyond traditional scans by visualizing cellular and molecular processes. This enables the detection of disease at its earliest, even preclinical, stages. Molecular imaging can also help build screening algorithms and guide early interventions, making it a powerful tool in preventive medicine. Imaging biomarkers are measurable indicators found through scans that help clinicians stratify patients by risk and monitor preventive measures. These biomarkers can reveal localized pathophysiology, such as tissue metabolism and perfusion, and are essential for identifying patients who may benefit from early or targeted interventions. The Ranostics is an exciting field that combines targeted imaging, diagnosis, and therapy into a single approach. By identifying how different parts of the body respond to treatment, the Radiognostics enables personalized, image-guided interventions. This approach is especially useful in cancer care, where it can help tailor therapies to the unique characteristics of each patient's disease. Imaging is now being used to guide individualized drug delivery systems. By visualizing how drugs are distributed and absorbed in the body, clinicians can optimize dosing and minimize side effects. This not only improves the effectiveness of treatments, but also supports the development of better drug delivery technologies. Let's clarify some important terms. Personalized medicine uses an individual's genetic profile to guide prevention, diagnosis, and treatment. Pharmacogenomics studies how genes affect drug response. Genomics uses genetic information to improve health outcomes. Radiogenomics links imaging features to genetic and molecular characteristics, while the Radiognostics combines diagnostic and therapeutic capabilities. Stratified medicine identifies patient subgroups who respond differently to treatments. Population imaging involves large-scale analysis of medical images in controlled cohorts or screening programs. This approach helps identify biomarkers that predict disease development and stratifies healthy populations into different risk categories. Each group can then receive tailored follow-up or interventions, improving overall health outcomes and optimizing resource use. Cardiac disease prevention showcases the power of individualized imaging. Patients are categorized as low, intermediate, or high risk based on classical risk factors and imaging biomarkers like CT-derived calcium scores or MRI-based plaque composition. High-risk individuals receive intensive treatment, while low-risk patients focus on lifestyle changes. Imaging biomarkers can predict disease development and guide personalized prevention strategies. Fetal Doppler studies are another example of imaging in preventive medicine. In the first trimester, these studies, combined with clinical and family history, help identify women at risk for preterm preeclampsia. Early intervention, such as low-dose aspirin, can then be initiated to minimize risk. This demonstrates how imaging, when integrated with other data, can lead to better maternal and fetal outcomes. While screening and individualized medicine offer many benefits, there's a risk of overdiagnosis, detecting diseases that may never cause symptoms or harm. Overdiagnosis can lead to unnecessary treatments, side effects, and emotional or financial burdens. The challenge for preventive radiology is to balance the benefits of early detection with the risks of overtreatment, always considering the patient's values and circumstances. Traditional diagnosis combines clinical findings, lab results, and imaging. Today, imaging can also reveal functional and molecular changes, providing a more complete picture of disease. Advanced techniques, like radiotracers, allow for better lesion characterization, sometimes reducing the need for invasive biopsies. This shift enables more accurate and less invasive diagnosis for patients. Imaging protocols are increasingly tailored to individual patient needs. Factors like patient weight, age, and kidney function influence the choice of imaging modality, contrast dose, and scan parameters. For example, low-dose CT is used for urinary stones, while MRI is preferred for spinal cord diseases. This customization ensures optimal image quality with minimal risk. Medical imaging is crucial in selecting the most appropriate therapy. By accurately staging disease, imaging can help avoid unnecessary surgeries and guide the choice of treatment. Consensus guidelines, based on large clinical studies, use multimodality imaging to inform decisions in oncology, cardiovascular, and cerebrovascular care, among others. Imaging-guided biopsies are now the standard for obtaining tissue samples. Techniques like ultrasound, CT, and MRI guidance allow for precise targeting of lesions, minimizing invasiveness and improving diagnostic accuracy. These methods are widely used in diagnosing prostate, breast, bone, and lymph node abnormalities, supporting better patient outcomes. Medical imaging provides both prognostic and predictive biomarkers. Prognostic biomarkers estimate disease progression without treatment, helping identify aggressive or indolent disease. Predictive biomarkers indicate how likely a patient is to respond to a specific therapy. Both types are essential for tailoring treatment plans and improving outcomes. Molecular imaging provides detailed information about physiology, metabolism, and gene expression. By tracking the distribution of molecular probes, clinicians can observe processes like cell proliferation, apoptosis, and angiogenesis. These insights help in staging tumors, predicting treatment response, and monitoring therapy effectiveness. Radiogenomics is an emerging field that connects imaging features with genetic and molecular data. By analyzing complex descriptors from clinical images, radiogenomics helps identify molecular subtypes of disease. This approach enables more precise diagnosis, prognosis, and treatment planning, especially in cancer care. Imaging plays a vital role in assessing how well a treatment is working. Objective measures from scans can indicate whether a therapy is effective, allowing for early adjustments if needed. This prevents prolonged exposure to ineffective treatments and supports timely changes to alternative therapies, improving patient outcomes. Beyond initial treatment selection, imaging is essential for ongoing therapy monitoring. Regular scans can detect changes in disease status, identify responders and non-responders, and reveal side effects early. This continuous feedback loop helps clinicians refine treatment plans and ensure the best possible care. Image-guided interventions, such as biopsies and minimally invasive surgeries, rely on real-time imaging to ensure precision and safety. These procedures reduce the need for open surgery, lower complication rates, and speed up recovery times. As imaging technology advances, the range and effectiveness of these interventions continue to grow. Radiologists are at the forefront of this new paradigm in healthcare. Their responsibilities now include promoting non-invasive imaging, integrating anatomical and molecular data, validating imaging biomarkers, and implementing image-guided interventions. Radiologists also play a key role in developing biobanks and personalized treatment protocols. Imaging biobanks are large databases that collect and store imaging data from multiple centers. These resources support research, help validate new biomarkers, and enable the development of evidence-based protocols. In India, establishing regional and national biobanks is a key step toward advancing preventive and personalized radiology. As imaging becomes more central to preventive medicine, ongoing training and skill development for radiologists are essential. Continuous medical education, workshops, and hands-on training ensure that practitioners stay up to date with the latest technologies and protocols. This commitment to learning drives quality and innovation in patient care. Research is the backbone of progress in preventive radiology. By identifying and evaluating new imaging biomarkers and integrating them with clinical algorithms, radiologists can develop evidence-based protocols that improve patient outcomes. Collaboration across institutions and regions is key to generating robust data and advancing the field. Preventive radiology should be integrated at all levels of healthcare: primary, secondary, and tertiary. Multimodality imaging can often replace invasive tests, making screening and diagnosis safer and more accessible. This integration supports early detection, timely intervention, and better health outcomes for the population. Developing India-specific guidelines and algorithms is essential for effective preventive radiology. These protocols ensure that imaging practices are tailored to the unique needs and disease patterns of the population. State-level committees and research teams play a vital role in creating, updating, and disseminating these guidelines. Ongoing education is crucial for radiologists to keep pace with advances in imaging technology and preventive strategies. State-level programs, workshops, and integration with postgraduate curricula ensure that radiologists are well equipped to deliver high-quality, personalized care. Collecting and analyzing state-level data on imaging biomarkers and their integration into clinical practice is vital. This data informs the development of evidence-based algorithms and supports continuous improvement in preventive radiology. Regional research teams are instrumental in gathering and interpreting this information. India's diverse population and unique health challenges require tailored research initiatives. Developing state-level clinical and preventive radiology research teams ensures that imaging practices are relevant and effective. These teams drive innovation and help create guidelines that address the specific needs of Indian patients. The future of radiology in India involves a shift from reactive reporting to proactive identification of abnormalities. Radiologists must embrace new skills, technologies, and research opportunities. By leading the integration of preventive and personalized imaging, they can shape the future of healthcare and improve outcomes for millions. Collaboration across disciplines is essential for the success of preventive radiology. Radiologists, clinicians, researchers, and policymakers must work together to develop and implement effective imaging strategies. Multidisciplinary teamwork ensures that patients receive comprehensive, coordinated care. Preventive radiology raises important ethical and social questions, such as access to care, affordability, and the potential for overdiagnosis. Addressing these issues requires thoughtful policies and patient-centered approaches. Ensuring equitable access to advanced imaging is a key goal for the future. Empowering patients with information about their health and imaging options is vital. When patients understand the benefits and risks of preventive imaging, they can make informed choices and actively participate in their care. Engagement leads to better compliance and improved health outcomes. The rapid pace of technological innovation continues to expand the possibilities of medical imaging. From artificial intelligence to portable devices, new tools are making imaging more accurate, accessible, and efficient. Embracing these innovations will be key to advancing preventive and personalized medicine. In summary, imaging in preventive medicine is transforming healthcare by enabling early detection, individualized care, and more effective interventions. Radiologists, clinicians, and researchers must continue to collaborate, innovate, and educate to realize the full potential of these advances. By embracing personalized and preventive strategies, we can look forward to a healthier future for all.